What is a lumbar laminectomy? That is the topic of this video. But first of all, I'm going to do a brief review of the anatomy so that I'm sure you understand what I'm talking about. When you look at the spine, it's actually composed of three parts. You have the neck, which is called the cervical spine. You have the chest, which is called the thoracic spine, and you have the lower back, which is called the lumbar spine. The lumbar spine is composed of 5 vertebral bodies. In the back, you have the spinous processes, which are interconnected to the spinous processes above and below by small joints. In the front, the vertebral bodies look like boxes when they're viewed from the side, and each of the vertebral bodies is separated from the body above and below it by a small cushion or disc. Down the middle of the vertebral body travels the spinal cord. At each level, a nerve is given off. All of these nerves join together in the buttock to form a larger nerve known as the sciatic nerve. The outer portion of the disc is composed of a strong ligament called the annular ligament. The annular ligament is torn or damaged. Some of the internal disc material can herniate out into the spinal cord or associated tissue. The herniated disc material can pinch one of the nerves as they exit the spinal cord. That will produce pain in the back, buttock, and down the leg, and the pain radiating down the leg is called sciatica. In most cases, disc herniations are able to heal naturally using conservative treatment such as physical therapy or chiropractic treatment. In some cases, there's too much pain, in which case epidural injections can be used to decrease the level of pain. Epidural injections are done by a qualified pain management specialist. If all conservative treatment options fail, then surgery may be indicated. In order for the surgeon to get access to the disc herniation, one option is a lumbar laminectomy. The surgeon is going to make an incision on the back of the spine, expose the back half of the bony spinal canal, and a laminectomy involves removing the spinous process as well as the associated lamina. The removal of the lamina is a laminectomy. This exposes the spinal cord, the associated nerve roots, as well as the disc herniation. The surgeon is going to pull the spinal cord out of the way, and the piece of herniated disc is removed. Keep in mind, all the disc is not removed, only that piece of the disc which is herniated. A lumbar laminectomy leaves the patient missing the back half of the bony spinal canal. Because of that, it is very important for these patients to get active as quickly as possible to avoid the defect being filled with scar tissue, and we especially don't want to see the nerve roots and the spinal cord enveloped in scar tissue. The more you do, the quicker you do it, the better you do. With the exception, we don't want to see you lifting heavy weights for at least the first 6 to 8 weeks. Typically, I will tell patients nothing heavier than 1 or 2 gallons of milk. Keep in mind, if somebody is going to reherniate a disc, they usually do it using a mechanism that involves not only lifting but twisting. You can twist, but be very careful not to twist while lifting weights. There are those conditions which almost always are treated with a lumbar laminectomy, such as spinal stenosis. Here at the Spine Center, with a standard disc herniation, we use minimally invasive surgery. With minimally invasive surgery, little or no bone is removed. Minimally invasive surgery is designed to not leave you with the weak back of a lumbar laminectomy. I hope you found this informative. If you have any other suggestions for videos or you have any questions, write to me at drsmith@elpasospinecenter.com. But the most important thing is give us a thumbs up and subscribe. Share the video. Tell your friends and neighbors. Thanks for watching.